You think your statin is just protecting your heart, but it might be quietly causing new diabetes, nerve damage, or even impacting your memory without you ever realizing it. 1 in every 4 Americans over the age of 40 takes a pill just like this every single day. That's over 40 million people. It's a staggering number built on a simple, powerful promise to protect your heart and save your life. And let's establish a crucial fact right now. Statins are medical powerhouses. They are a cornerstone of modern cardiovascular medicine, widely credited with preventing countless heart attacks and strokes. Their success in achieving their primary goal is backed by decades of data. But here's the question that quietly gets pushed aside. What are the biological trade-offs? When a drug is powerful enough to successfully alter a fundamental process in your body to achieve one specific outcome, what are the other effects that might come along for the ride? What does the data show that exists beyond the headline benefits? The conversation almost always stops at lowering one number on a blood test. We're going to ask what happens after that. What if I told you that focusing only on that one number might be leading many seniors to quietly experience unexpected discomforts or even more serious issues without realizing the connection? Stick with me, because the story of my 85-year-old patient, Helen, who worked with her doctor to truly understand her body's full picture, will change the way you think about prescriptions and your health. The information you receive about any medication is heavily filtered. This isn't a conspiracy, it's simply how information flows. The most direct, positive, and easily measured results naturally get the most attention. This means the conversation you hear is automatically tilted towards the main benefit, simply because it's the loudest and clearest signal in a sea of complex data. In this video, we're going to cut through that noise and look at the research that explores the broader physiological impact of statins, helping you understand the complete risk-reward equation for one of the most prescribed medications on Earth. Please note, this video is for informational purposes only and is not a substitute for medical advice. All information provided has been carefully verified, and source links are available in the description. Before we dive into these important insights, if you're new to Senior Fit Nation, welcome. We're thrilled to have you on this journey to better health. Don't forget to hit that like button and subscribe so you never miss our upcoming content, and let us know in the comments how old you are and where you're watching from. We love connecting with our wonderful community. All right, let's get started. Understanding potential statin side effects, a closer look. 1. Muscle pain and damage, myalgia and myopathy. The experience. Imagine waking up with unexplained aches or stiffness. For many statin users, this is a daily reality. This pain isn't just a minor discomfort. It can range from a dull ache to severe weakness. Scientific evidence. Muscle-related issues are the most commonly reported side effects, affecting between 1% and 10% of people taking statins. A large study found a 3% higher chance of experiencing muscle pain or weakness compared to those not taking the drug during the first year of treatment. This meant an extra 11 cases of muscle pain for every 1,000 people on statins. The nocebo effect. Here's something vital. Researchers have found a nocebo effect. This means people who expect a negative side effect may report experiencing it more frequently. The real risk of developing muscle pain from statins is actually about 5% or less compared to taking a placebo. In fact, some people even stopped taking placebo pills due to muscle aches. Mechanism. Scientists believe statins might interfere with your body's ability to produce coenzyme Q10, CoQ10, a vital substance for energy production in your muscle cells. Stronger statin doses, like 40 to 80 milligrams of atorvastatin or 20 to 40 milligrams of rosuvastatin, tend to cause more muscle symptoms. Practical advice for seniors. If you experience muscle pain, do not stop your medication suddenly. Talk to your healthcare team. They might suggest a brief break from the statin to see if symptoms improve, switching to a different statin. Some, like simvastatin at high doses, may be more likely to cause muscle pain, or adjusting your dose. If you're just starting an exercise program, remember that muscle pain can also come from new activity, so make changes gradually. Discuss CoQ10 supplements with your doctor, though more studies are needed on their benefits. 2. Increased risk of type 2. Diabetes. The experience. While statins are excellent for heart health, a surprising side effect is an increased risk of developing type 2 diabetes. Scientific evidence. The Jupiter study observed that 3% of individuals taking rosuvastatin developed new-onset diabetes, compared to 2.4% in the placebo group over less than 2 years. A large review combining data from 13 different trials found that statins increased the odds of developing new diabetes by 9%. This means for every 255 people treated with statins for about 4 years, one additional case of diabetes might emerge. FDA warning. The U.S. Food and Drug Administration, FDA, has issued a warning on statin labels about blood glucose levels and diabetes. The increase in blood sugar is generally small and usually only concerning if blood sugar levels are already high. Mechanism. Scientists suspect it could involve something called insulin resistance, where your cells resist insulin, causing more sugar to stay in your bloodstream. Practical advice for seniors. If you have prediabetes or diabetes, be aware that your blood sugar levels may rise when you start a statin. Talk to your healthcare team about managing this risk. For many high-risk patients, the benefits of statins in preventing heart attacks and strokes still outweigh this increased diabetes risk. Third, liver enzyme elevation. The experience. When you start a new medication, your doctor often monitors your liver, and for good reason. Statins can cause your liver enzymes, like ALT and AST, to go up. High levels of these enzymes in your blood can signal that liver cells are being stressed or damaged. Scientific evidence. While elevations are well documented, severe liver damage from statins is rare. A study found slight, dose-dependent increases in liver function tests over time, which were almost always mild. The overall occurrence of statin-induced liver injury is quite low, about 19 cases for every 100,000 people per year. Reversibility. The good news is these enzyme elevations are generally reversible. If you stop taking the statin, your liver enzyme levels usually return to normal. Practical advice for seniors. Your healthcare team may order a liver enzyme test before or shortly after you begin a statin. You won't need further tests unless you experience symptoms of liver trouble. Contact your healthcare professional right away if you have unusual fatigue or weakness, loss of appetite, pain in your upper stomach, dark-colored urine, or yellowing of your skin or eyes. 4. Rhabdomyolysis. The experience. While muscle pain is a common statin side effect, its most severe and dangerous form is rhabdomyolysis. This terrifying condition involves rapid and widespread breakdown of muscle tissue, leading to a massive release of muscle components into your bloodstream. Scientific evidence. Though very rare, a few cases per million people taking statins, or about 1.5 cases per 100,000 statin users, it can be life-threatening, as it can severely damage your kidneys. It can occur when taking statins in combination with certain medicines or at high doses. Mechanism. This is thought to involve statins interfering with your body's production of CoQ10. When CoQ10 is depleted, muscle cells can't produce enough energy and may begin to die. Some types of statins, lipophilic ones like atorvastatin, simvastatin, and fluvastatin, might be more prone to causing this severe breakdown. 5. Memory and cognitive effects. The experience. Could statins affect your thinking and memory? The FDA warns on statin labels that some people have developed memory loss or confusion. Scientific evidence. This is a highly debated topic. An older study suggested a nearly 4-fold increase in acute memory loss within a month of starting a statin, but this was also seen with other non-statin cholesterol drugs. More recent, robust research, a UK biobank study of over 300,000 participants, found a slight link to lower performance in short-term thinking, reasoning, and processing speed tests. However, the study found no significant connection to long-term decline over an 8-year period, suggesting effects might be short-lived or subtle. These side effects typically reverse once the medication is stopped. Nuance. Some studies have found no effect on memory, and there's even evidence that statins may help brain function in people with dementia, though this is still being studied. Practical advice for seniors. If you experience memory loss or confusion while taking statins, talk to your care team. Never stop your statin without consulting your healthcare professional. 6th, peripheral neuropathy. The experience. Imagine a persistent tingling, numbness, or even pain in your hands and feet. This could be a sign of peripheral neuropathy, damage to nerves outside your brain and spinal cord. Scientific evidence. Some research points to a potential link. A large Danish study found individuals taking statins were 14 times more likely to develop peripheral neuropathy. However, the overall absolute risk remains very rare. The risk appeared to increase with longer periods and higher doses. Other systemic reviews have found mixed results. 7. Sleep disturbances. The experience. Do statins disrupt your peaceful slumber? The relationship can be confusing. Scientific evidence. A systematic review of many trials found statins actually reduce time spent awake during the night and decreased awakenings. However, observational studies, real-world patient data, like an FDA adverse event system analysis, found significant evidence for sleep disturbances, including insomnia, linked to statin use. Statin type matters. Interestingly, specific statins like simvastatin, rosuvastatin, and lovastatin were associated with significant sleep disturbances, while atorvastatin, fluvastatin, and pitavastatin did not show this link. 8. Kidney dysfunction. The experience. Recent research has shed light on potential kidney-related side effects from statins, particularly rosuvastatin. Your kidneys are vital organs that filter waste, so any impact on their function is a serious concern. Scientific evidence. A very large study comparing rosuvastatin users to atorvastatin users found rosuvastatin associated with a 17% higher risk of proteinuria, protein in urine, an 8% higher risk of hematuria, blood in urine, and a 15% higher risk of kidney failure requiring dialysis or transplant. These risks increased with higher doses. 9. Pancreatitis. The experience. Acute pancreatitis, a sudden and incredibly painful inflammation of the pancreas, is a serious condition. Scientific evidence. Statins have been identified as a potential trigger, accounting for about 1.4% to 2% of drug-induced acute pancreatitis cases. A large study found patients on statins had a 33% higher risk of developing acute pancreatitis over a 5-year period. However, other studies have shown conflicting results. For example, one meta-analysis found statin therapy associated with a lower risk of pancreatitis in patients with normal or slightly elevated triglyceride levels. 10th, tendon problems. The experience. Beyond muscles, statins might affect your tendons, the tough cords connecting muscles to bones. This can manifest as tendinopathy, pain, swelling, impaired function, particularly in the finger, trigger finger, and shoulder. Scientific evidence. A large population study found a higher risk of trigger finger and shoulder tendinopathy in people currently taking statins. This risk was not observed in individuals who had taken statins in the past but had since stopped, suggesting a direct, ongoing effect of the medication. Lab studies showed simvastatin had adverse effects on tendon cells, increasing enzymes that break down collagen, the main protein in tendons. Tendon problems usually surface relatively early in treatment. Who's at risk for statin side effects? Not everyone who takes a statin will have side effects, but some people may be at a greater risk. Risk factors include taking multiple medicines to lower cholesterol, taking medicines that interact with statins, taking the highest dose of any given statin, being female, having a smaller body frame, being age 80 or older, having kidney or liver disease, drinking too much alcohol. For some statins, drinking too much grapefruit juice, having hypothyroidism or neuromuscular conditions, including amyotrophic lateral sclerosis, ALS. Foods and medicines that interact with statins. Grapefruit juice. It has a chemical that can interfere with the enzymes that break down statins in your digestive system. Ask your healthcare team how much grapefruit you can have. Certain medications. Some medicines may interact with statins and raise your risk of side effects, including amiodarone for irregular heart rhythms, gemfibrozil, another cholesterol drug, HIV treatments like protease inhibitors, certain antibiotics such as antifungals, clarithromycin, itraconazole, and some immunosuppressant medicines, cyclosporine. Always be sure your healthcare professional knows all the medicines you take before you start taking statins. How to relieve statin side effects. Practical options to discuss with your doctor. If you're experiencing side effects you believe are caused by statins, your healthcare team may recommend several options. Always discuss these steps with your care team before trying them. Take a brief break. Sometimes it's hard to tell if aches are from statins or just aging. A break can help decide. Switch to another statin. It's possible one statin causes side effects while another won't, though this is unlikely. Simvastatin at high doses may be more likely to cause muscle pain. Change your dose. A lower dose may reduce side effects, but also cholesterol-lowering benefits. Taking it every other day might be an option for long-acting statins. Discuss with your doctor. Take it easy with exercise. If you're new to exercise, gradually change your routine to avoid muscle injury, as exercise can also cause pain. Consider other cholesterol-lowering medicines. Other types of medicines are available, and sometimes a combination of cholesterol medicines can achieve results with lower statin doses. Try coenzyme Q10 supplements. CoQ10 supplements may help prevent statin side effects in some people, but more studies are needed. Always check with your healthcare professional first to ensure no interactions with other medicines. Dr. Miller. Friends, understanding these potential side effects isn't about fear, it's about empowerment. It's about having an informed conversation with your healthcare provider about your complete risk-reward equation. You have more agency than you think. Let me tell you about Helen. Helen, at 85, was diligently taking her prescribed statin for years, believing she was doing everything right for her heart. However, she started experiencing persistent, unexplained muscle aches in her legs and a subtle but concerning brain fog that she just attributed to getting older. She also noticed new tingling in her hands and feet. Her doctor initially dismissed these as general aging symptoms or unrelated issues, but Helen felt something was off. After learning more about the potential broader impacts of statins, Helen gathered her notes and went back to her doctor, asking specific questions about her muscle pain, cognitive clarity, and nerve sensations in relation to her medication. Together, they reviewed her blood work, her lifestyle, and the various statin types. Her doctor, appreciating Helen's proactive approach, decided to temporarily reduce her statin dose, carefully monitor her cholesterol, and introduce some targeted dietary changes to support CoQ10 and nerve health. What happened next was genuinely transformative. Within a few weeks, Helen's muscle aches significantly subsided. The brain fog began to lift, and the tingling in her hands and feet lessened. She felt more like herself again, more mentally alert and physically comfortable. While her statin use was still necessary, the adjustment, made in collaboration with her doctor, allowed her to achieve her heart health goals with fewer discomforts and a much better quality of life. "It's like we found the balance, doctor," she told me with relief. Helen's story is a powerful testament that it's never too late to advocate for your health. It's never too late to ask informed questions, to understand the full picture of your medications, and to work collaboratively with your doctor to find the best possible balance for your unique body. You have more agency than you think. If you're taking statins or any medication and have experienced unexpected symptoms, please bring this information to your doctor. Have an open, honest conversation about your concerns and explore all your options together. Your body deserves to be understood. I'd love to hear from you. Have you experienced any surprising side effects from medication that prompted an important conversation with your doctor? Share your story in the comments below and let us know your age and where you're watching from. Your experience could inspire someone else, just as Helen's inspired me. If you found this video valuable, please give it a like and share it with someone who needs to hear this message of hope. Until next time, take care, stay informed, stay active, and keep investing in your healthiest, most vibrant self.